Thank you. Can technology build global trust and safer international travel in the COVID-19 era? We started our efforts to answer this question in Namanga, an East African city straddling the border between Kenya and Tanzania. To cross the border, there was no mandatory 14-day quarantine, but you needed to have a recent negative COVID laboratory test. What we found when we arrived in Namanga was trucks lined up for miles, waiting to cross the border, and truck drivers, hundreds of truck drivers, waiting for days and weeks for laboratory testing and for laboratory results. The East African community is a group of 6 countries that work together cooperatively at the head of state level of those 6 countries. 2 of those countries, Kenya and Tanzania, have port cities. 4 of the countries in the East African community are landlocked. One of the critical needs for the East African community was to be able to move trucks, generally loaded with food that was essential for the 4 landlocked countries, from the port cities in Kenya and Tanzania. The East African community asked us to help them with building a digital platform that might more easily convey recent negative COVID-19 testing results. Could technology build a digital platform that protected the privacy of these truck drivers and helped them more efficiently cross the border while complying with country entry requirements that are designed to protect the health of their citizens? On the right, you'll see an example of what these truck drivers were waiting for: a paper attestation of a negative COVID-19 laboratory testing results. On the left, you can see one of these truck drivers at Namanga testing a prototype app we built based on their input and connected to a digital platform that protected their privacy, provided a way to know what the latest border crossing requirements are, provided instructions and support about how to meet these requirements, and then lastly, transmitted verifiable digital credentials after meeting these requirements that could be used for border crossing. These are some of the essential workers who agreed to be photographed and allow us to share their photos with you. These truck drivers bring food from Tanzania and Kenya to the other countries in the Eastern African community. We talked to them to understand these challenges and helped test digital solutions. Saidi, Kuria, Stephen, and Karanja. We thank them and others who helped us understand what they needed to more efficiently do their important work and to do this work more safely in helping us build a solution for border crossing. This is the announcement track of the health conference. So I'm really pleased to make an announcement today. And that announcement is that the Commons Project has partnered with the World Economic Forum to bring this solution that we originally developed in the East African community for truck drivers, essential workers in that part of the world, to bring this solution to the rest of the world. And this work is in progress as we speak. In collaboration with the World Economic Foundation, we've convened more than 50 countries and other major stakeholders to provide input in the design of what we're now calling the CommonPass framework. We're actively working with more than 20 of these countries at the most senior government levels and with all the major airlines and other stakeholders involved to coordinate our efforts. A part of the solution that's needed to use technology to build global trust, we believe, is careful attention to the kind of organization that builds and operates these services. We've created the Commons Project as a nonprofit public trust to specifically build global digital platforms and services for common good. We are purpose-built and specifically designed, managed, and governed to use technology to build global trust. We look for global opportunities to use technology to build and operate a common good, serving people's interests above all other interests. And we've brought together a leadership team with deep global experience that's relevant to this task. Deep expertise in health, technology, mobile devices, and health data interoperability. As just one example, I was at CDC for 2 decades, working around the world on infectious diseases and vaccine development. I led the anthrax investigation following 9/11 for CDC, and I served as the Chief Strategy Officer at CDC for 6 years. Since leaving CDC, I've worked in senior healthcare positions and started companies in genomics and digital health. My other colleagues at the Commons Project have similarly deep expertise in their relevant areas of contribution to our efforts. I'm excited now to show you what we learned, not only in East Africa, but across these many convenings that we've conducted in collaboration with the World Economic Forum. The singular most important finding in these listening sessions is that countries are looking for a way to trust COVID laboratory results and reports of vaccination. They want to be able to trust these records presented at the entry to their borders as their #1 desire for a framework like the one we're proposing. We found that there's 4 key questions or areas of questions that need to be addressed in the CommonPass framework. First, is the laboratory that did the testing or the vaccination site that delivered vaccination, are they fully accredited? Do they have the credentials? Do they have the support of the government and other accrediting bodies to do that work within the country? What kind of laboratory test was used? What's the regulatory status of that test? The same things for vaccines. When did that vaccination occur? If there's 2 doses, did they get both of those doses? And if it was a laboratory test, what was the result? There's an important identity issue with this framework. Is the person that received the vaccine or had the laboratory test the same person that is presenting themselves to cross an international border? And finally, when you add up all that information, do they meet the country entry requirement, yes or no? To be able to answer these questions, we've identified a number of critically important framework elements. First of all, a registry of accredited laboratories and vaccination sites, a common model for health data interoperability. This wouldn't have been possible a couple of years ago. We believe it is now possible to do that at a global level. We've instituted what we think is the leading edge of privacy preservation for individuals, linking these laboratory results and vaccination records to their identification. And importantly, there needs to be a way for countries to flexibly and continuously update and publish their screening criteria for entry into their country. These criteria need to be flexible with changing epidemiology as well as changing science. And finally, this needs to all be put together. The data that is relevant to a particular individual, the entry requirements in a country, to check against the rules to make sure they meet the country entry requirements. Lastly, this framework is going to be open. So we have to include tools that allow third-party apps and systems to integrate and use this as a utility at a global level. Our privacy principles are extremely important to the Commons Project agency. We only act with the informed consent of individuals. We only use the minimum amount of data to conduct any transaction. Data generally stays on an individual's mobile device or if not there, in the location where it was originally generated in a government registry, in some cases in electronic health records, in other cases. And data are only used to the extent necessary for the intended purpose and never used for any other purpose. This is the last sort of view of the pieces, the questions that I reviewed and the elements of the CommonPass framework, with an individual undergoing testing or receiving a vaccine on the left, the components of the CommonPass framework, the registry of labs and vaccination sites, the accessing of data from registries, electronic medical records, Apple Health or CommonHealth as a digital wallet on mobile phones. And then lastly, the health screening rules, the health attestation about symptoms that countries require on entry into their country. And then finally, having that data rolled up and then compared to the country entry requirements on the CommonPass compliance engine. Importantly, no health data are actually ever conveyed to border officials or airlines or anyone else. What the framework does is it prints basically a travel certificate or an entry certificate that is simply a green or a red, indicating whether you meet the country entry requirements or do not. And those are the only data that are provided to immigration or airlines in the context of the platform. I'm really hopeful to be able to answer the question I started with in the affirmative, that technology in the right hands, in an organization that's structured to do this, that technology can build global trust. And that in this particular use case, it can also make international travel safer during the COVID-19 era. We're in the process of early implementations of the CommonPass framework, working with many governments, laboratories, vaccine makers and distributors, major airlines, airports, and border control authorities. Please feel free to contact me or the Commons Project with questions or interest. We'd be delighted to have you follow our progress. Thanks very much.